We have with us today Professor Lars Fugger from the University of Oxford.
Specialty is within
Mhm.
diseases of the immune system. And so when I started out many years ago, I trained at Stanford in California. MS was even more of
Yeah.
an enigma as compared to today. And in those days,
Mm.
it was thought that the MS was originating in the brain because clearly all the manifestations, the symptoms, the disease is within the brain. And so the only treatment was hydrocortisone, which by far is a long-term solution. And also it has a number of side effects and it has a bit of an acute effect. In any event, what became apparent was that the MS
Mm.
was, and that was a perplexing observation, originated in the immune system outside the brain. The brain. So, and that's how I came into this as an immunologist. So,
Ah. I was diagnosed, Lars, before they had the first
yeah,
beat interferons.
yeah,
I
exactly.
got my first
And
beat
so this
interferons
was,
at Oxford with Professor Palace.
oh, no, there
Yeah,
was
but
nothing. I
was
mean,
it was
literally
just there was nothing.
nothing.
You just had to go. Oh,
And
okay. Mm.
so I'll just give you a brief account of what then happened, because the idea then was that the immune system was playing a role in MS, but also that viruses was playing a role in MS, and because of viruses having a suspicious role in MS, patients were treated with interferon because it was thought we could sort of dampen the immune
Mm.
response to a virus by giving interferon.
Yeah.
And the thing is, I normally say that I'll come back to this in a second, but now you mentioned interferon. I normally say that the best thing interferon did to the patients was not its efficacy, but showing that there was, which is hugely important, that there was a market in treating MS patients, and it was possible to move on from hydrocortisone. Because the big pharmaceutical companies in those days were reluctant, and that's an understatement, to invest in a drug development program because they didn't see any profit in it. But what
Mm.
it is, no, it is.
Yes, it's very, very
Yeah,
profitable now. You take
yeah, no,
cladribine,
no.
the exact
So,
same
so
drug
what it
for
showed
cancer is
was
one
there
fifth
is
of
a
the cost
market,
of
and
it
it's a
in
horrible
MS.
thing to say, but it is an important driver for the big pharmaceutical companies to go into a drug development program. So beta interferon had, some effect much more than hydrocortisone. So, let's just say, roughly speaking, maybe 20-30% efficacy. And but it was enough to convince
Mm.
people that it was possible to start to treat MS patients more seriously. And the good thing about interferon was, of course, also that it had very few side effects. I know those who have the side effects find them difficult because you will know better than anyone else this could be flu-like symptoms. But yeah, yeah, yeah,
Or injection site reactions, just constantly stab I mean,
yeah.
not
Yeah,
really a
yeah.
drug thing, but the fact that you have
So
to
in
stab
any
yourself
event,
every
so
other
what
day as it
happened
was
over
then,
the
but,
next
yeah.
20 years, 25 years was there came big studies in the genetics of MS. And so they were showing that the entire genetic risk, the predisposition, the inherited predisposition to MS was found in genes or near genes that are found in the immune system. This is the immune system called the peripheral immune system because it's sort of in our periphery in blood and lymph nodes and so forth. So all the genes conferring risk to MS were immune genes. And that was an eye opener. Because, as I said, it was believed that the disease originated from inside the brain. And all of a sudden, we had to take almost 180 degrees change in our perception of the disease. So the root of the evil, which turned out not to be evil, I'll come back to that in a second, but the root of the disease came from outside the brain and then moved across and started to cause what you know as a multiple sclerosis. Uh,
Oh, and Lars, your research just within the MS
yeah,
community in the last couple of days, ever since the BBC picked up on that and made that thing, it's caused, I wouldn't say there's no concern, but it's made an impact because in the way that beta interferon suddenly let you know that people were willing to treat you, shall we say, it's an unknown disease, like you say, or and this whole everybody's
yeah.
got an idea,
So,
and you're
so,
one
so
of the
just
people
coming
that's
back
starting
to
to put
this,
your
so
finger
that
on
paper,
why.
as you know, was published in a journal called Nature last week, and it sort of blew us out of the water
Mm,
because the media attention was just overwhelming. So we have counted, or somebody has counted, more than 800 different media outlets. And so it went into, as you said, I just mentioned BBC, but also the New York Times and the Washington Post. So
mm,
this was what they call a big story, and we are not
yeah.
used to that kind of media coverage. But fortunately, so the big papers got it right, and because some of the minor papers got it badly wrong, and I'll explain. Yeah. So
That I was going to
So I
ask you
had
if you
been
thought it had
speaking
been fairly
to some of
represented
these
and accurately
reporters, and the
reported.
ones from the big papers are good, and they will understand what you are trying to explain. And what I said was that this story. So for those of your viewers or listeners who might not be aware of this, this was a paper showing that the genetic risk, the MS risk genes, could be tracked back to 5,000 years ago and to a steppe population living where Ukraine and the Caspic Sea is the area. Yeah, yeah. And so these
Mm.
were people.
They were herders,
So
is
it's a
that correct?
multi-layered
Yeah.
sort of explanation. So I'll just take it step by step. So
Yeah.
we could track these risk genes back to this steppe population and 5,000 years ago. And this steppe population was undergoing one of the biggest lifestyle changes in our human evolution because they started to live with domestic animals, and they were eating meat from these animals, and they were also drinking milk and yogurt and cheese from these animals. But and but 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 the important thing here is they, of course, didn't know how to pasteurize uh, milk and yogurt and cheese, and all,
Yeah.
uh, so
Well, it was
they
the
would be exposed
fermentation, wasn't
to
it?
a
And
level
then,
of
after a point.
what's called pathogens. I mean, bacteria, viruses living in undercooked meat and in milk that was not
Mm,
pasteurized. But also because they were living with the domestic animals, they would be exposed 24/7 to the parasites, worms, what have you, that these animals were carrying. So this steppe population called the Yamnayas were bombarded with these microorganisms, bacteria, viruses, parasites, worms. So clearly that would require for them to survive, to have or to develop a strong immune system. And so that is the old story about survival of the fittest. So those who would survive would have certain genes that would give them an advantage, they would be able to sort of fight off this bombardment of microorganisms. But so what we found was that those genes that had been selected for. They had been enriched because these people needed them to survive. Uh, those are the same genes that today confer risk to MS. So the important thing for me to say was, and that's why I said we thought we would be coming to the root of the evil, but there was no evil. I mean, these genes were normal genes, and they still are normal
Mm.
genes. So one thing I was a bit worried about was when in some media that these genes were mentioned as mutations, which we know from cancer. And I made that quite clear to those I spoke with. They are not mutations. They are normal genes. And they have been selected for
Mm.
because they give us an advantage in our immune system. Today, they're still normal genes. The biggest genetic risk factor in MS is found in 1 in 4 in the population. Just to give you sort of an understanding of how common it is. And it's just a very important part of our immune system. So the story was that the genes that are conferring risk, predisposing to MS today, were enriched for, were selected for 5,000 years ago because they gave the steppe population an advantage in fighting off bacteria, viruses. Uh, mm.
So where does the EBV, the Epstein-Barr virus,
let me
fall into
just
this? Because that
let me just
within
finish this,
again
and I'll
within the
come back
MS
to that.
community, that's a big
And so
thing.
you could ask yourself, so
I
how come these genes today are risk genes in MS? And we don't have a very clear picture of that. But one thing that is quite clear is that these genes were selected for, as I said, when the steppe population was undergoing one of the big lifestyle changes in our evolution. Within the last 50 years, we have, in our part of the world, undergo another of the biggest lifestyle changes in our evolution. And these genes are now casted in a completely different environment because we don't have the same pressure where we live of pathogens, of viruses, bacteria, worms, parasites, and what have you. But they are sort of coming into a world where they were not really meant to be operating, right? So the popular explanation is that because of that, there now is an imbalance because our immune system and what the immune system should be fighting. The immune system should be busy fighting all kind of infections. But in our part of the world, even though we might think so, but we don't have this load of infections any longer. And that is simply because of, we have much better sanitation. We have antibiotics, we have vaccines.
mm,
And that has just meant that our food is pasteurized. I'll just give you an example of how um, this has changed. 150 years ago, 25% of newborn children died. So you can see things have changed dramatically just within the last century or so.
well, exponentially, we've suddenly,
Well, exactly.
things that
That's
we don't
exactly
think
my
about
point.
today
And
were
also
a thing
because
100
when
years
I'm
ago.
going 5,000 years back, this selection for this enrichment for genes didn't happen overnight. That, of course, also took a long period of time. So we're sort
Yeah.
of trying to find our feet in this new environment, as you know, and MS is more likely than not a modern disease. This is not a disease that is likely to have been a problem or even have
Mm.
been occurring 5,000 years ago. More likely than not, MS is a modern disease where, and now I'm coming to the point where the immune system is getting confused. And instead of fighting infections, all of a sudden it starts to attack the brain and the spinal cord. And that's where we sort of started out. MS is coming from outside the brain. And the way we are treating MS patients today, and I think that's an important point for all of you, is we are treating MS patients by dialing the immune system. Yeah. And so that is being done in different ways. But the overarching theme is that it's sort of, it's not a very specific way of dampening the immune system.
No, I mean, I had alemtuzumab, which is
Yeah. But
essentially I
it's
always
also
liken it
important
to
to
a
bear in
sort of
mind
machine
that
gun at everything,
even these drugs
you
are not perfect. They have made a big change in the way patients are being treated because, as we were discussing when we were both young, uh, the options were limited. Today, patients can be given, for instance, one of the antibodies against B cells, anti CD20, and they will be able to go back and
Mm.
if it's a young woman to go back, live a normal life, get children, go back to work for a number of years. And but my point is with this paper is I'm now coming to the point. The point of this paper was, first of all, we were trying to demystify the disease by showing that the genetic risk is coming from normal genes. So I think that is an important message because young mothers who have had children and who get MS will ask, will I pass this on to my children? And as you know, and as your viewers, listeners will know, there's a very small risk for that. And it should, of course, be seen in the context that these are normal genes. They are really, really. So it's not like that.
Yeah. Mm. So what do you think with this, what do you think accounts or can you say from the research is that there's a great female bias in MS in the sense that it affects females a great
No,
deal more than males. And is there anything
no.
in this
So,
genetic
so,
work that
so
you've
we have
done that
also been looking at
would
this. We have been
inform why
looking
that
at
was?
this over the years. It's not only MS. It is, with a couple of exceptions, it's a common denominator for autoimmune diseases that women are more at risk of getting these diseases. No, it's not only rheumatoid arthritis.
So not just
Yeah, of
MS,
course.
but
No, no, I
others.
understand
Ah, okay.
that, but
I operate in this
it's
tiny world of MS, so
I simply don't know why that is. Inversely, which we are working on right now, that women with MS who get pregnant or women with rheumatoid arthritis who get pregnant will get a disease modifying effect of pregnancy. So the disease will be less aggressive while they
yeah.
are pregnant. So clearly, whatever is
Mm,
going on, it has to do with some hormonal change by a reconfiguration of the immune system, by being a woman, maybe by sex hormones, by or maybe the absence of other hormones that you and I have, and clearly also in pregnancy, trying to hold on to the little baby, which is half uh, father and half mother, will also have an effect. So we are trying to find out what
mm.
are these endogenous mechanisms that can sort of keep disease at bay.
Right. Is there
And
anything in this research? I mean, we all see it and hear it and think, as the lay people, the outsiders, the immediate thing is there anything about what you've found that would have any impact on, say, my or anybody
no,
else's treatment in the next
no,
12, 24, 36 months? Or is
yeah.
this
So I'm
learning something to
normally a bit
inform future
underwhelmed when I
development?
see basic science papers, and then people will come out and say, there you go. This will influence the treatment within, and then they will give a number of months or years. And I think that's hugely unfair to the patients, because they will, of
Mm,
course, hope that is the case, and they will call the GP or the treating neurologist the next day, and they will be hugely disappointed. Exactly. So I'm always
It's
worried
the
about
hope
this.
that
So I
kills
want to
you.
be
That's
clear
the phrase. Yeah.
and to say
Yeah.
this is a piece of basic research. It's helping to demystify the disease, but it's also helping
Mm,
for us to understand that the way forward is trying to find in new drugs the balance in the immune system instead of just suppressing it. Suppressing it it has really been helpful, but clearly we need to strive to constantly
mm,
optimize the treatments, and clearly the way to optimize treatment is to balance the immune system, but also clearly to stop disease in its tracks
mm.
as early on as possible.
And that's what they're trying to do with HSCT, but apparently evidence of EBV will come back after a while after the HSCT treatment.
Yes.
You mentioned you come back to the EBV. Can I drag you back because I'm not the expert, but I know it's spoken about hugely, and I read something by David Baker, Professor Baker at QMUL, sort of saying that it was observed. I think it was like sort of 57 further 100 years ago, in then Danish people
So,
eating, I think, tree sap or something. I mean, it's chicken and egg. I mean, did
okay.
EBV come first or did
No, 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 no. There's, I mean, no. I think
I
you're
kind of
asking the
don't know,
question
Lars, how to ask the
very.
question properly. If that makes sense.
So what? So we now need to go even further back, and because no, but it is important because we have been living with EBV as
Yeah, yeah, yeah.
humans
No.
since we were monkeys almost. So EBV has been with us for millions of years, right? And so EBV is not a new thing. And I
Right.
think that is also important to understand. And I'll just give you some facts about this, because most of us will be infected with Epstein-Barr virus when we are toddlers, and that will
Hmm.
cause a snotty nose, a sore throat, just like a normal cold, like all toddlers have. It's not. Yeah, well, exactly, and that's not really seen
Yeah,
as a risk factor.
permanently.
The risk factor comes if you don't get the infection as a toddler. So if you have the infection as an adolescent or a young adult, where it will manifest itself as glandular fever, mononucleosis, right? That's where the risk is coming, and then the risk goes
Yeah.
up considerably. And that is not so. So we need to be cautious about these
Mm.
black and white statements. That is not the same to say, and it's
Yeah.
important for me to really make this clear. Because you have had late onset EBV, because you have had glandular fever, is not does not mean that you will get MS. It's a risk factor.
I was gonna say it
Yeah,
increases the
yeah.
risk. It's like
So I
driving
think that's a
without a
good
seatbelt.
metaphor.
You may never have a
So
problem,
it
but
increases
if you
the
do.
risk, but it's many factors increases the risk for getting MS, and I'll get back to that in a second. But late onset, and when I say late onset, it is opposed to early onset as a toddler. Late onset is typically as a teenager when you get the infection. That will increase your risk. So there's been
Mm.
a number of, well, there's been in particular one paper recently in Science where they were demonstrating, yes, that is a risk factor. And then there's been a speculation over the years why EBV was a risk factor. And I would say, and I'm not saying this in any other way than just making it clear that EBV is a complicated virus, and it could have a number of ways of increasing the risk for MS. And so there's a lot of speculation right now what it is. It could be more than one. That would be my bet. And it could be different from person to person. So I think we need to be careful about not saying it's because of. I can
Oh,
roll up the
sure.
explanations, but
But does
I'm
EBV,
I'm just
does your
saying,
research
let's just wait
Oh,
and see.
sure,
The 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 the
sure.
question, of course, what is the consequence of us
But
realizing
sorry,
that
sorry.
MS, to a certain extent, I won't say it's caused by EBV is a risk factor in MS. What is the consequence of that observation, right? So people have been trying to treat with drugs that is or are targeting viruses. There's no really clear evidence. Yeah.
Well, there's been a couple of case studies published
But AIDS
recently of AIDS
patients,
patients. Is
eight,
it on
yeah, but okay.
tenofovir
So
or
let me just answer that. So AIDS patients. No, you're not. You're just asking a lot of interesting
I feel
questions,
like I'm
and I
complicating
will
it to
address
my
them.
ignorance.
So AIDS patients are different in the sense that one of the hallmark of their diseases is that they have a wipeout of a certain population of immune cell called T cell. If you take them out of the equation, MS
Mm.
has very poor sort of chances of developing. So that's I'll stand by that. Um, with EBV, so what is the consequence of this? The consequence, of course, is that you take EBV out of the equation, right? And how do you do this? Well, you do the yeah, you can yeah. So we've just seen
The
this with
childhood
Corona, of
vaccination
course, with
that some
COVID,
people are
how
talking about.
helpful that was to handle a virus.
Mm.
Now the thing is that, as I said, and it's coming back to, we've been living with EBV for a very long time. And in most of us, it's not really creating any problem. So having MS, living with MS is, of course, suboptimal, right? To put this mildly. Yeah. It yeah, it's actually quite unfortunate, right? And it
Yes, you're quite.
yeah, and it causes a lot of suffering, right?
Yeah, I'd swap it.
But also, EBV is also associated with a certain form of cancer, which we fortunately don't see in this part of the world. But my point is, it's still a very small minority of those who are infected with EBV that will get any of these diseases. The question is, if you population-wide start to take this virus out of the equation, what will that mean? Because I think some balance has been found between the virus and the population. Mm.
But like you said, this genetic changes that conferred protection against certain things possibly
Uh,
increased risk of MS on the other. I mean, to me, it's like a kitchen knife. You know,
Yeah.
you've got
So, but
different
also it's just
ones.
coming
One
back
is
to what
really
I
good at
said,
stuff,
and
but it's
because
not good at
these
other
genes
stuff.
were clearly superior in one particular context, right? They are also really good today, but the context for some of us
Hmm.
has changed. Yeah. So they sort of cast it in a different way. So as I was saying, I just wanted to point out that the EBV is not the only risk factor, and so yeah, yeah.
No,
Oh, no, no. Yeah,
it's just
no, no,
popular in
and it
the
is. Trust me, it
community,
is
should
a
we
risk
say,
factor.
because of that big
Mm,
US study. And but
yeah,
everybody, in
yeah,
my
yeah.
view, always wants to take
That's
one
not how
thing and just
MS
pin it
works.
on it and
No,
go,
it's
"That's
not,
it," and
and that's
it's never
why
that
I
simple.
keep on saying there's a very good reason why
No.
MS is called a complex disease, because it is complex, and it's not a one trick pony.
Yeah,
And so I think we just need to come to terms with that. We need to sort of circle around this disease in smaller and smaller circles to find out what it is. And then, just like an onion, take layer by layer, and then
right.
get to the core to find out what are the different layers, how do we treat each layer, and then and
Oh, that's a good analogy, Lars. I'm not asking you to commit, but is this do you think the way the rate that we're progressing with our knowledge and sort of tightening the circle, is this going to be a 5, 10, 30, 50 year kind of um, effort on the part of people like you and
So I'm very cautious
tightening the circle,
as I
tightening the
think.
net and getting to
No,
it?
no, but because it's not fair to the patients.
I appreciate I'm not
Simply
trying
not
to
fair
get
to
you
the
to
patients.
commit.
No, I know,
Yeah,
but
yeah.
let's just I
But
mean,
we
let's
also
just
want to
go
have an idea
backwards
that
again. So 20 years ago, when did you start to get beta interferon? 20 years ago or so? Uh,
yeah, it was in the cost sharing scheme on the NHS. It was Professor Palace. It was I was because I worked for a drug company at the time.
So you can
I'm
see
so
within
I was
20
sort of banging
years,
on the door
we have
and
gone
saying,
from
"When can I
having
do this?"
hydrocortisone in the cupboard, right? And today we have, 10, maybe more different drugs,
Hmm,
and they have a much better efficacy. So the way things are developing right now, I think it is likely that things will sort of speed up in trying to get new drugs to treat the disease. But
hmm.
I just wanted, as I said, I just want to be very, very cautious about the pipeline. The important
I completely appreciate that. It's just
that is
the
so
hope
I want to
kills you,
make
but you
this
want to
clear.
have hope for
Yes,
something, even
I
if it's hope
was,
for
and
20 years'
so when
time.
I started to speak about MS when I was a young medic at Stanford, I had seen patients, right? I was hugely pessimistic about this. The professor I was working with said, "Don't work with MS. It's too complicated," right? So that was sort of the way it was perceived. My point is, things have moved, and there is a movement in trying to get new therapy into MS. So I can tell you, after having worked with MS for what was it, 5 or 10 years, I realized when I was looking backwards, I said, because I had some of the manuscripts from my talks, that I was starting to say, there's light at the end of the tunnel. And that sort of came to me step by step because I saw that people across the globe are working on this disease. Yeah. And so what has changed is that, first of all, when we are studying MS, we need certain tools in the box to study the disease. And those tools are constantly getting better. The other thing is, when I started out, and it's not about me, but it's just to exemplify it, it was hugely difficult to study MS by studying patients. So a lot of MS studies were based on cells in culture, were based on rats, mice, and it was helpful in those days, but clearly, I mean, there's a difference. So what has changed today is that we and other groups are now studying MS by studying patients with MS, right? And in by doing that, you will get closer to the patient, of course, and closer to what's going on in real time, instead of constantly have to make all these assumptions based on working with, you know, cell lines, mice, rats, what have you. I think that is a
Mm.
major step forward. And also, there's a major drive forward to try to diagnose patients earlier and to start to treat patients earlier and not just wait for things to sort of have gone.
Yeah. Well,
Yeah,
the data's there for early intervention with high efficacy therapies, and I'm still astonished at the people that don't, but,
there is,
the
and that's
doctors,
exactly my
but
point. There is a
many,
change
there's a
happening
change happening.
in perception of disease, but also in how do we do this and how do we take it forward. And so, yes, there is hope, and there's much more hope as compared to when I started, and things will happen. You,
Lars, I think that's an excellent point to wind this up because
no,
I suspect
I
it's one of
mean,
these topics
when
we could
you
probably
asked me,
talk
I
about
said
on and on and on.
unedited.
But
Because I can talk to newspapers, I can talk to here and there,
mm,
but the important thing for me is still to talk to those who will be interested in what's happening. And that, of course, will be the patients and those who live with the patients. Yeah. So
Oh,
I'm very grateful for that.
you're preaching to the choir. Everybody's really keen to hear what you have to
Well,
say. I've already said to a few people, I'm get to interview Professor Fugger. It's going to be yeah, and now I have a
you're
bunch of
very
editing work this
welcome. And
afternoon to
thank
do to make
you.
sure that I get it up
I
as
would just
quickly as
say
I can.
that to all of those who are listening
But
to
Lars,
this and
thank you
have a
so much
personal stake
again.
in this, rest assured, people are trying to make this a disease that's easier to live for. Rest assured.